It is very stressful to liken going to work like going to war.
What was your day at work like today?
Every day at work, it just gets progressively worse and worse and worse. Walking to full waiting rooms of people coughing, spreading what's possibly COVID-19 to one another. Stretchers lined outside the hospital, down the block, waiting to be triaged. It's mayhem, it's chaos, and then the overhead pages. People calling upstairs for cardiac arrest after cardiac arrest after cardiac arrest, likely related to COVID-19. It's a pandemic, and what we're dealing with is truly horrific. My fellow colleagues have been working in this job much longer than I have. I'm relatively new. I've been only doing this for about 1 to 2 years as an attending physician, and including 4 years of residency. I've seen older physicians, taking their job with grace and magnanimity, and not be able to get too flustered under difficult circumstances. I have now seen them scared for the first time.
How stressful is it for you when you go in every day to do your shift?
It's a form of PTSD, where every morning I wake up and I feel from my face whether I have a fever, as if a soldier wakes up every day wondering they've been shot, right? And then I have to go to work knowing that I'm throwing myself in harm's way without adequate protection. No matter how much I've done this before, no matter how many patients I've taken care of, it is now becoming an emotional, moral injury where we need to go in because we are heeding a calling, knowing that it may hurt us and our family and loved ones when we bring this back home, right? This is not something that just ends in the emergency room. This is war, where everything that we do pertains to not just our work, but public health and society and our private lives. I intubated a nurse last week, my own nurse that I used at a hospital I used to work in, and she just died, right? A week later. She was young, and it was just terrifying. And she's actually one of many healthcare workers who have died in the line of duty in the past 3 weeks. And our colleagues have become our own patients. It gets to a point that I'm wondering when I'm going to be the patient next. Is it my turn in 5 to 10 days when the symptoms manifest? I mean, when we get sick, who else is going to be around to take care of you?
Is there any stories where someone, I hate to say it, has died in front of you in the ER?
I had one patient that had presented to the emergency room 2 days prior with symptoms of diarrhea and abdominal pain. He ended up being COVID-19 positive. His oxygen was a little low, so the team that took care of him 2 days before decided to admit him to the hospital. He seemed fine. His vitals were fine. The nurses that took care of him seemed like he was in good spirits. By the time I started my shift at that hospital, he had already been admitted for 2 days to the hospital, waiting for a bed upstairs, but the hospital was full. And as we're taking care of other patients that were coming in, and the emergency room started to break down because more and more patients were coming in, he ends up going into cardiac arrest, right? And then 10 minutes prior, someone said they helped him up and he seemed fine, but all of a sudden he went from speaking to dropping dead. And when his heart went flatline, we rushed in. We worked on him for an hour, and I ultimately was the only doctor there. I had to pronounce him and tell a family about a patient I did not even know about because he was already admitted to the hospital for 2 days. He had belonged to the doctors upstairs. And to navigate through this emotional journey is just very sobering, to realize that now we are now dealing with a virus that is putting us at edge in terms of our capacity of taking care of the patients the way that they should be taken care of. I wish that he was upstairs in his own room, treated by a team of doctors that knew him and saw him through in the last 2 days, rather than an emergency room physician, a per diem one, coming in, not knowing anyone, any of the patients had been there for 2 days, and then still having to be there at the end of his or her life, and then explain to a family what had happened when all hell's breaking loose behind him. So that is my reality.
How old was he?
He was about 50. Yeah, this virus kills you faster than you expect. You are literally coming in with mild symptoms, and then the cytokine storm hits you, and you are literally talking, even though your x-rays, your blood work shows that you're in dire straits, but you feel great, and all of a sudden you drop dead. That is what I'm seeing. This virus kills you fast. You look at someone, they look great, and all of a sudden they're dead. So do you be aggressive in your care? But there's now a theory that if you intubate them too early, they die, right? Do you not be aggressive? Then you regret not doing enough. it's just this dilemma that we're facing every day, and that makes work more stressful than it was the day before.